Ever wondered why you feel unusually tired or why you're losing weight without even trying? Could it be a thyroid disorder? Welcome to our comprehensive guide on hypothyroidism and hyperthyroidism. These are common conditions that affect the thyroid gland, a small organ located in your neck that plays a crucial role in regulating your metabolism and hormone production. When the thyroid gland doesn't function correctly, it can lead to hypothyroidism or hyperthyroidism. Hypothyroidism occurs when the thyroid gland doesn't produce enough hormones, slowing down your body's functions. In contrast, hyperthyroidism is characterized by an overproduction of thyroid hormones, causing an increase in your body's metabolic rate. In this video, we'll delve into the causes, symptoms, diagnosis, and treatment options for these conditions. Stay tuned to learn more about these common yet often misunderstood health conditions. What exactly is the thyroid gland and why is it so crucial to our health, you might ask? Well, nestled comfortably in the front of our necks, the thyroid gland is a small but mighty part of our endocrine system. It's responsible for creating and releasing hormones into the bloodstream, specifically triiodothyronine, T3, and thyroxine, T4. These hormones play a vital role in regulating our body's metabolism, which is the process of how our bodies use energy. But that's not all. They also influence our heart rate, body temperature, and even our mood. Imagine it as a maestro orchestrating the symphony of our body's functions with precision and balance. However, like any good conductor, the thyroid gland requires precise control to function correctly. It relies on the pituitary gland, which sends thyroid-stimulating hormone, or TSH, to tell it when to produce and release these hormones. So what happens when this vital gland doesn't function as it should? Let's delve into that next. Hypothyroidism is a condition where the thyroid gland underperforms. But what does that mean for your body? Well, picture your body as a car. The thyroid gland is like the engine that keeps everything running smoothly. When the thyroid gland doesn't produce enough hormones, it's akin to running your car on a near-empty tank. The car, or your body, slows down. This condition is what we call hypothyroidism. Now let's delve into the reasons behind this hormonal shortfall. Hypothyroidism can stem from a variety of causes. It could be an autoimmune disease like Hashimoto's thyroiditis, where your body mistakenly attacks the thyroid gland. Sometimes a prior thyroid surgery or an iodine deficiency can also trigger hypothyroidism. So, what signs should you look out for? Hypothyroidism often manifests as fatigue, weight gain, cold intolerance, and dry skin. You might also experience slower heart rate and constipation, but hypothyroidism is not just about immediate symptoms. If left untreated, it can lead to long-term complications. These may include heart problems, infertility, and even mental health issues like depression. It's crucial to remember that these symptoms can be subtle and easily mistaken for other conditions. Therefore, if you suspect you might be dealing with hypothyroidism, reach out to a healthcare professional. They can provide a proper diagnosis and guide you through the next steps. Now that we've understood hypothyroidism, let's move on to its counterpart, hyperthyroidism. Hyperthyroidism is when your thyroid gland is in overdrive. What impact does this have on your body? Imagine your thyroid gland as a car engine. Now, imagine that engine running at full throttle all the time. That's what hyperthyroidism is like. It revs up your body's functions, causing an increase in your metabolic rate. This overactivity can be due to various causes, the most common of which is Graves' disease, an autoimmune disorder. In this condition, the body's immune system mistakenly attacks the thyroid gland, causing it to produce more hormones than necessary. Other causes can include thyroid nodules or inflammation of the thyroid gland. Now, what does this mean for your body? The symptoms of hyperthyroidism can be quite diverse, ranging from weight loss and rapid heartbeat to heat intolerance and tremors. You might also experience increased sweating, nervousness, or changes in menstrual patterns. But hyperthyroidism isn't just about symptoms. Left unchecked, it can lead to serious complications. For instance, it can increase the risk of heart problems such as atrial fibrillation, a condition characterized by an irregular and often rapid heart rate. It can also lead to osteoporosis, a condition that weakens bones and makes them more likely to break. In extreme cases, it can cause a life-threatening condition called thyroid storm, characterized by a sudden and severe increase in metabolic rate. Diagnosing these conditions is the first step towards managing them. Let's find out how. How do doctors determine if you have a thyroid disorder? It's a crucial question, and one that involves a combination of clinical assessments and laboratory tests. Typically, the first step is a thorough evaluation of symptoms and medical history. If a thyroid disorder is suspected, blood tests are usually the next step. These tests measure levels of thyroid-stimulating hormone, TSH, and thyroid hormones, thyroxine, T4, and triiodothyronine, T3. If the TSH level is too high or too low, it could indicate that the thyroid isn't functioning properly. In some cases, imaging studies such as ultrasound or thyroid scans may be done to assess the thyroid size and structure, and to identify any nodules or inflammation. Biopsy may also be performed if a nodule is detected. These diagnostic tools together help to accurately identify the type and severity of the thyroid disorder. Once diagnosed, what are the treatment options available? Let's explore that in the next segment. Treatment for thyroid disorders can bring your body back in balance. For hypothyroidism, where your thyroid gland doesn't produce enough hormones, the most common treatment is hormone replacement therapy. This typically involves taking a daily pill of synthetic thyroid hormone, such as levothyroxine, which can help restore your body's hormone levels and reverse the symptoms of hypothyroidism. On the other side of the spectrum, we have hyperthyroidism, where the thyroid gland is overactive. Treatment for hyperthyroidism aims to reduce the production of thyroid hormones. This can be done through anti-thyroid medications, which prevent the thyroid from producing excess hormones. Another option is radioactive iodine therapy, which uses radiation to shrink the thyroid gland and reduce its hormone production. In some cases, a surgical procedure known as thyroidectomy may be necessary to remove part or all of the thyroid gland. It's important to remember that these treatments are not one-size-fits-all. Your healthcare provider will consider your specific condition, the severity of your symptoms, and your overall health before deciding on the best treatment plan for you. Also, keep in mind that while these treatments can be highly effective, they may take some time to work. Patience and regular checkups with your healthcare provider are key to managing these conditions successfully. But is medical treatment enough? Can lifestyle modifications help manage thyroid disorders? Absolutely. When it comes to thyroid health, what we eat, how we move, and even how we handle stress can make a significant difference. Diet plays a fundamental role in thyroid health. Consuming a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can support overall health and help manage symptoms. Iodine, selenium, and zinc are especially important for thyroid function. Exercise, too, can be a vital part of thyroid health management. Regular physical activity can help regulate metabolism, improve energy levels, and even enhance mood. Stress management is another key area. Chronic stress can disrupt hormonal balance, potentially exacerbating thyroid disorders. Incorporating stress-reducing activities like yoga, meditation, or even simple deep breathing exercises can be beneficial. And let's not forget, smoking can adversely affect thyroid function. If you're a smoker, quitting can significantly improve your thyroid health. Remember, untreated thyroid disorders can lead to serious complications. Thyroid disorders can significantly impact your life, but they are manageable with the right approach. In our journey today, we've explored the critical role of the thyroid gland, a small but mighty organ that regulates metabolism and hormone production. We've delved into the world of hypothyroidism, where a thyroid deficiency slows down bodily functions, and hyperthyroidism, which revs them up excessively. We've also navigated the paths of diagnosis, from blood tests to imaging studies, and examined various treatment options, from hormone replacement therapy to lifestyle modifications. It's clear that managing thyroid disorders involves a comprehensive approach, including medical treatment, diet, exercise, and stress management. And let's not forget, individuals living with these conditions can still lead fulfilling lives. It's all about understanding the disorder, early detection, and consistent management. Remember, early detection and management can help you lead a healthy and fulfilling life, even with a thyroid disorder.